Director of Radiology at PM Pediatric Urgent Care, where he leads imaging innovation across the urgent care industry. He has streamlined imaging operations, standardized protocols, and launched limited X-ray licensure programs to address workforce gaps. Chris also advocates for legislative change to expand access to radiologic services in urgent care. Welcome to DX the Podcast, Chris.
Thank you.
Yes, we're so happy to have you today.
I'm so happy to be here and talk about some X-rays.
Yes, so much work you've been doing. I mean, honestly, you are truly an expert in this limited license X-ray efforts kind of world we're living in. So overall, can you kind of just give me a state of the state, we'll call it? Talk to me about the background. Where do these efforts stand kind of across the U.S., and what's your stance as it pertains to urgent care?
Yeah, of course. So, limited licensure has been around since it was first introduced in the state of Mississippi in 1972.
Oh, wow. Okay.
So way before I was born. And since then, 33 other states have adopted limited licensure pathways. Mm-hmm. And there's currently, across the country, we're working in various different states to outline those pathways.
Mm-hmm.
So it seems to be as you go up towards the Northeast, the regulations tend to get a little more stringent.
Sure.
So states like New York, Massachusetts, New York, we're doing a lot of work in New York. Mm-hmm. Not just myself, it's alongside Naruka, a great team at Naruka.
Sure.
We've had bills introduced the past 3 legislative sessions in New York.
Wow, congrats.
We were really hoping they would pass this session, but we didn't get it there.
Yeah.
So Massachusetts, I've been helping the coalition there. Louisiana, I've been helping the coalition there. So those are legislative efforts that are ongoing. And then again, you have 34 states that already have that pathway.
Yeah.
Really, one of the difficulties is it varies state by state. Mm-hmm. Regulations vary across the board. Mm-hmm. So you have some states that allow limited operators to apply for licensure to take X-rays of the skull, the extremities, spine, podiatry, the whole gamut of things. And then you have some states that only allow podiatry, and then not only that, but the educational requirements and the examination requirements, those differ from each state too. So some states, you don't have to have any education. You just have to pass the ART limited scope exam.
Wow. And
then other states, you have to do didactic, which I completely support, didactic and clinical education, and then pass the ART exam. But I think the state of limited licensure right now is, there's some inconsistency across the board that I would in the long run like to see everything become consistent, especially for urgent care operators that are trying to train, limited license techs. But I think one of the greatest successes we've had is I was part of a large coalition in Maryland last year where we actually passed a law.
Awesome.
And I got to stand by the governor while he signed that.
Oh, cool.
It was great. So there's a lot of good work going on. And a lot of good people doing that work. So I'm happy to be part of those teams.
So tell me about the history for urgent care specifically, as they're navigating this world of not enough X-ray techs, and kind of maybe when did this really start to come to really become a reality, and when did it really start to bubble up where the realization is we have to advocate for this came really clear?
Well, I mean, the shortage of rad techs that we're seeing today is completely unprecedented. Mm-hmm. I mean, it's really bad. So the ASRT actually put out a white paper, I think in the spring of this year or late last year, whenever that was. And they actually evaluated, they put numbers to it.
Oh, boy.
And so it's the worst, the shortage of rad techs right now is the worst that it's ever been since the ASRT started measuring that metric in 2003. So, the shortage of rad techs is exacerbated in the urgent care setting because what we find is rad techs, they want to do X-ray, right?
All day long.
I don't blame them. I'm a rad tech.
Sure.
I wouldn't necessarily want to work clinically in urgent care either because 95% of the time you're not doing X-rays. You're doing more of
just depends on what walks through the door and what the volumes are.
So you ask, when did that become an issue for urgent care? I think it's probably always been a little bit of an issue for urgent care, but it is now that much worse, especially post-COVID, when we're seeing shortages of a lot of professionals, not just rad techs.
Yeah.
And so that's why we have to find these alternatives to the rad tech, like limited scope operators or limited license techs, whatever you want to call them.
Yeah, for sure. So what's your vision for how we can all come together and work towards a I mean, no one's going to find like a perfect snap your fingers resolution, but how can we best all work together to find resolution to this shortage and this issue? Because we know how important, radiology is for urgent care.
Yeah. I think people have to collaborate despite competition. We're all urgent care operators, and I think there's always the competition aspect that's in the back of your head, like we don't want to work together.
Sure.
But that's silly, especially when it's a common cause that we're fighting for, right? That's affecting all of us.
Right.
And I think it's that people, like to give you an example with what we're doing in New York, I was just talking to them about it out there earlier. It's really 3 or 4 of us that are pushing this effort, and Naruka's got the lobbyists, but people just have to step up and help, you know. And I think another thing is, like, you have to realize that you're not going to get an immediate return on your investment because legislative work takes time.
Takes a while, yeah.
But once that work's complete and stuff starts to pass, that return is huge, not only for whatever urgent care operator we're talking about, but for the industry as a whole.
Yeah.
And people really, I think there's a little bit of a mindset change that might need to happen there. And they need to, understand the importance of legislative advocacy.
Yeah. I wonder, too, if some operators are just not sure what direction to even turn or even think about. So, they think about the staffing they have and how is this even possible? If they're not there, they're just not there. But the reality is it's actually about maybe training up the staff you already have. So tell me a little bit more about that.
Of course, yeah. So, that's limited licensure, in a nutshell.
Right.
That's what we want to use it for in urgent care is. And don't get me wrong, I'm a huge proponent of training. I'm a proponent of licensure. All of that is super necessary to produce quality images and take good care of our patients. But the way that looks, I'll give you an example of within PM.
Yeah.
So I have regional leads across the country. And so they oversee, regionally X-ray and quality and all of that good stuff. And so they provide the clinical training to my limited trainees or, students, whatever you want to call them.
Sure.
And then we have a didactic program that comes from a company called Control the Dose. They've been around for, I think, over 40 years now, or somewhere up in that range.
Yeah.
So the didactic program comes from Control the Dose, and then our regional leads oversee it on the regional level and provide that clinical training.
Great.
And I think, it's really important that that's an avenue, right? So that's an avenue for operators, urgent care operators, in the states that allow, because not every state allows for that type of training or even limited licensure.
Yeah.
But you have to, it can also create a barrier because you have to have those X-ray techs in leadership positions for this to be successful. And I will say that until I'm red in the face. If Dr. Bob, in his standalone urgent care, which is great, doesn't have an X-ray tech to oversee that training, it's not going to be successful.
You have concerns, yeah.
And again, so it's an avenue, but it also creates a little bit of a barrier because, as an urgent care operator, you need to kind of instill that structure and that leadership team to make that training program successful.
And that kind of opens up the window for the collaboration you talked about earlier. So the standalone urgent cares maybe could be thinking forward about how could we collaborate to have maybe an X-ray tech that leads over several standalones. That collaboration is key for their survival, because we've talked about in the past, and we kind of talked about in our prep, having X-ray on site can be a very specific reason that patients choose to go to your site or not. So maybe talk a little bit about that as well, and how that maybe sets certain urgent cares apart.
Yeah, so, I think that X-ray holds a very important part, as it applies to, it is integral to urgent care operations. And I think that, we look at when I think of radiology, I look at high-performing radiology kind of urgent cares and low-performing, if you want to call it that, radiology, urgent cares with radiology. And I think that, the world we're living in, patients want convenient care.
That they can rely on.
And that they can rely on, and they want it accessible to them now.
Yes.
And that includes X-ray. So if I bring, I have a 3-year-old, if I bring him in and he's whatever fallen and hurt his hand.
Right.
I want that x-ray to be done there.
Yeah.
I don't want to have to leave that urgent care, to go to diagnostic imaging center, or I hope not the emergency room where I'm gonna wait for 4 hours.
Yeah.
But so the way I look at kind of a high performing urgent care clinic that has radiology is, obviously that x-ray should be available during all hours of operation.
Because you never know who's going to come through the door.
You should, and you've spent the money on the equipment,
Yes.
if you need to use it.
Right.
And, so availability is huge. So if you have x-ray, make sure that's up. And secondly, it kind of goes beyond just having the machine and somebody to take your x-ray, right? So it goes back to like that leadership structure and that oversight. So it's great you have somebody to take the x-ray, but is that person trained properly to do that? It's interesting. A physician can walk into an x-ray room in most states without any prior knowledge or training and take an x-ray. So you could go in, if I need a chest x-ray, and say, okay, Chris, I'm going to take your x-ray. Did you learn anything about x-rays in medical school?
Very minimal.
About how to take them?
No. I mean, very minimal training on how to take them.
Yeah,
that's
and
for
it's just
sure,
interesting to me that, physicians in most states can without any training, but we have some people that are, opposing limited licensure, which requires training. And exam.
Yeah.
Anyway, so there's got to be that oversight.
Yeah.
You have to have, so yes, availability is great, but you need to have somebody overseeing your program.
Sure.
That is looking at those images from a quality perspective.
Yeah.
Doing QC.
Yeah.
So it really, I'm a big supporter of having some kind of radiology leadership within your organization. That could just be a X-ray tech that works clinically all the time, and you call them a lead, and they do all of that quality assurance and training and et cetera. But so availability, oversight, and training is a big one. I think those are two huge portions of
providing that quality experience for the patients.
Yeah. And a high performing radiology clinic.
Yeah.
The other thing is too, I think if we look at the numbers, about 10% of patients that come into us in urgent care generally end up with some kind of x-ray order.
Yeah, with
right?
an injury.
And so if we look at it from the business side of things, in urgent care, we're not making money off of the x-ray most of the time.
Right.
We're not making that much money off of the x-ray itself, right?
Yeah.
When it's kind of just it sucks money from us.
Right. It's a modality we need to decide what to do clinically for the patient.
It's kind of it's necessary, right? But it does bring you volume, and that makes you money, right? So a high-performing urgent care clinic with radiology is getting that, they're getting the revenue from that added, say, 10% of patients that come in. Whereas if we look at a low performer, their X-ray machine is. They probably don't have anybody to take the x-ray.
And the patient has come and gone in the past and found out there's nobody available to take the x-ray and had to go elsewhere. So
and not only then
behavior.
do you lose that patient, you not only do you lose that visit,
word of mouth.
But if I bring if I bring my child to an urgent care and they don't have x-ray availability, I'm probably not going to come back for future visits either.
Yeah.
So then that's compounded, right?
Very fascinating.
Yeah.
All right. So lots of advocacy work you've been doing over many years. Tell our listeners how they can specifically get involved today. So opportunities that deserve a platform to advance urgent care or specifically radiology. What is some tangible kind of method by which people can get involved if they're ready to get involved today?
Yeah. So I think the Urgent Care Association is wonderful. They have a great advocacy manager. Her name is Kristen Rastatter, I think. Sorry, Kristen, if I pronounced your name wrong. I think they're a good first team to reach out to.
Entry level, let's see what I can start doing.
Like if you want to start with grassroots, but also there's state or regional subchapters too, like Naruka, Kaluka, and they all, work in government affairs. They have government affairs committees.
Yeah.
Reach out and say, hey, I want to help. How can I help?
Right.
I've seen smaller urgent care operators do that a lot. Like, hey, can I join the meeting?
Make big changes by just reaching out.
Sure.
Right? Yeah.
Yes. And me, like, if you want to join, especially limited efforts for limited licensure in various states, then everybody blows up my phone.
Sure. So you're ready.
One or two other more people would not be
go.
a problem. And we would certainly appreciate as much support as we can get. So
love it. Well, thank you so much for your passion and how much you care about the success of limited licensure and how that affects the success of urgent care overall. It was great to talk with you today.
Great talking to you. Thank you.
Hope to see you again at DX the podcast.
Yeah, thanks so much. I appreciate it.
DX the podcast was born out of the idea that we are ready to diagnose the future of urgent care with the smartest leaders in the industry. Find all the other episodes on Spotify and LinkedIn to keep up with us in this journey.